right, we are live. It's Sean again with Green Relief. And if you guys have not done so already, check out our new website. We revised it, greenrelief.com. I'm actually at the Mills, Virginia location, hanging out with my homie, getting all zenned out here in the massage therapy room. This is actually really good for lower back pain, and that's what I want to talk about today, because I believe it's up to 80% of Americans typically suffer from lower back pain, which is a crazy amount. So we actually, this is kind of our auto accident location. We specialize with auto accident patients here. We've got a chiropractic room next door. We have physical therapy. We have a rehabilitation room. So all of these things that if you've been involved in an auto accident, you can check it out. But one thing you have to remember is getting to this point where you become a patient. Okay. The one thing that I would suggest doing is immediately after this video, I would go check out the other video I did with Keith. He's a medical assistant at the other location, and he breaks down the application process to getting your medical marijuana card, as well as the appointment process. And I want to just kind of gloss over really quick that second appointment, because once you set up that first one and you get everything done, we're going to the state will actually send you an email that will basically serve as a temporary card. So it's just a letter through an email, and it'll say, hey, you've been approved, and they'll mail you one, which you'll get in like a physical copy of it. Okay, and once you do that, you'll be able to schedule your follow-up appointment with our doctors, and then we're going to give you that treatment plan, and you can go to dispensaries and get yourself whatever products that our doctors recommend. Okay, and plus you'll be able to get yourself a nifty little t-shirt. So the first one is free if you become a patient with us. The second one's just $10, so you can spread the good word about Green Relief. All right, so once you do get your product from one of the dispensaries, or if you have CBD recommended, you can get that here at a Green Relief location. And what we can do with that is actually, sorry, I'm just adjusting here. What you can do with that is you can start a little log, or this is something that a lot of people do with like diet and exercise, is they'll write everything down. And if you do that, you're actually going to be able to see how this affects your body, and how, like, especially if we're talking about lower back pain today, you'll be able to see, hey, what doses of this, and this affect you at different times of the day. And after 3 to 4 weeks, we're going to recommend that you schedule a follow-up with our doctors again, and just see how that treatment plan is going for you. That's really the biggest thing, is making sure that you keep track of it, because later on, 6 months, a year, 2 years down the road, we want to make sure that we've got it dialed in for you and you're getting the best pain relief. Okay. Now, what I wanted to talk about a little bit more in depth, though, is the back pain. And if you have back pain, please go to our website, greenrelief.com. Schedule an appointment if this is something that you've been dealing with for a long time. I know personally I have a couple people in my family who deal with this, and it's definitely debilitating. Sorry about that. All right, so one of the things for lower back pain is you want to think about getting strains or medical marijuana that is more of an indica based. Okay, indica is something that we also recommend for depression, anxiety, or anything like that. The higher the THC content, that's going to be a little bit more for other things that it's not necessarily geared towards feeling that body. Okay, so indica is more of a body high. Sativa is from the neck up, more in the head. Okay. And also indicas have more CBD content, and that's just the way that those plants are designed. Now, the really cool thing about this, especially if you have, let's say, sciatica, you want to find a strain, and we'll recommend that. Well, you want to find a strain that's going to give you it's THCA, which is THC, but it's the acidic precursor to THC. Okay, so if you remember, THC gives you that the high feeling. Okay, but THCA is a powerful anti-inflammatory, which, if you're experiencing sciatica, can really decrease the symptoms of that sciatica. Now, because you will have a higher amount of CBD in that indica strain, you're going to feel a lot more relaxed, especially in the back. You can also have more topical lotions. I went over that, let's see, Wednesday. I use that a lot for my shoulders after I work out. So that's also another option. But you have to remember that, again, the indica strains are designed for any kind of body pain. That's what they are grown for, and that's what we recommend for lower back injuries or lower back pain in general. All right, so now the reason why I'm in this room is because you kind of have to, you got to do a couple of things with that lower back pain. You definitely want to medicate with the indica strains, but you also want to have some massage therapy, or maybe go to a chiropractor, or maybe even do some yoga. There are a couple of yoga poses that are really popular that you can easily find online, and we can recommend some to you. That's why we have this location here in the Mills 50 area on Virginia Avenue, is because not only are we doing auto accident patients, but we're also helping people with physical pain. Okay, and again, if this is making sense to you, definitely check us out. Go to agreenrelief.com, get an appointment set with one of our doctors, and we'll be able to give you a treatment plan that utilizes indica strains, CBD oil, whatever you need. It's going to be customized for you. Okay, now, so you want to definitely get hooked up on the indica strains, because again, they have higher CBD content, which is cannabinoids, which are going to help that body sensation where you feel more relaxed and you're not feeling as much pain, and because they are anti-inflammatory. So again, a lot of sciatica is because that sciatic nerve that runs through your hip and down the leg, that gets irritated, that gets pinched, and if there's less inflammation, the less pain you're going to experience. Same thing if you're dealing with degenerative back disease, where your discs are actually the vertebrae are actually rubbing together, and that creates a lot of pain. Personally, I know a couple people who have done other procedures that burn the nerve endings so you don't feel anything, which is not going to turn out well in a couple of years from now. So you definitely want to take care of the source. You don't want to just start burning things or taking any kind of prescription pills, because again, that's just that's addictive, and that's not really good for your body. I would also recommend, let me actually just grab this. This is a book. It's by Dr. Rav Ivker, Cannabis for Chronic Pain. I would highly recommend getting that book. It's very interesting. He breaks down everything. He actually suffered from a really bad case of shingles, and he cured it with cannabis. All right. So if you have any kind of back pain, please let us know. Let's help you out. Get your medical marijuana card. Start getting yourself some indica strains with medical marijuana, and supplement that with some CBD oil. Okay? All right. I will see you guys soon, and I will talk to you. Bye.